sunlight, more than just a tan. Sunlight, the life-giving energy source of our planet, has been revered and worshipped across cultures for millennia. While excessive exposure carries risks, moderate and responsible sun exposure offers a plethora of health benefits, far exceeding the simple acquisition of a tan. This article delves into the diverse and profound advantages of sunlight, exploring its impact on physical and mental well-being. 1. Vitamin D synthesis. The sunshine vitamin's crucial role. Perhaps the most well-known benefit of sunlight is its role in vitamin D synthesis. When ultraviolet B (UVB) rays from the sun reach our skin, they trigger the production of vitamin D3 cholecalciferol. This vitamin plays a critical role in calcium absorption. Vitamin D enhances the absorption of calcium from the gut, essential for maintaining strong bones and preventing osteoporosis. Immune system modulation. It supports a healthy immune system, reducing the risk of infections and autoimmune diseases. Muscle function. Adequate vitamin D levels contribute to muscle strength and function, reducing the risk of falls and injuries. Cell growth and differentiation. Vitamin D regulates cell growth and differentiation, potentially playing a role in cancer prevention. Cardiovascular health. Some studies suggest a link between vitamin D deficiency and increased risk of cardiovascular disease. The recommended amount of sun exposure for vitamin D synthesis varies depending on factors like skin pigmentation, latitude, and time of day. Generally, 10 to 15 minutes of midday sun exposure on the face, arms, and legs, several times a week, is sufficient for most people. 2. Mood regulation and mental well-being. The sunshine effect. Sunlight has a profound impact on our mood and mental health. Exposure to sunlight triggers the release of serotonin, a neurotransmitter one associated with feelings of happiness and well-being. 2. This can alleviate symptoms of seasonal affective disorder. SAD is a type of depression that occurs during the fall and winter months, when sunlight is limited. Light therapy, which mimics natural sunlight, is a common treatment for SAD. Depression and anxiety. Increased serotonin levels can improve mood and reduce symptoms of depression and anxiety. Improved sleep. Sunlight helps regulate the body's circadian rhythm, the internal clock that controls sleep-wake cycles. Exposure to sunlight in the morning can promote better sleep at night. 3. Enhanced immune function. Strengthening defenses. Beyond vitamin D's role in immune modulation, sunlight itself has direct effects on the immune system. Nitric oxide production. Sunlight stimulates the production of nitric oxide in the skin, which has antimicrobial properties and can help fight infections. T-cell activation. Sunlight can activate T cells, a type of white blood cell that plays a crucial role in immune responses. Reduced inflammation. Some studies suggest that sunlight exposure can reduce inflammation, which is implicated in various chronic diseases. 4. Blood pressure regulation. A natural vasodilator. Sunlight can help lower blood pressure by stimulating the release of nitric oxide, which relaxes blood vessels and improves blood flow. Lowering hypertension. Regular sun exposure may contribute to lower blood pressure in individuals with hypertension. Improved cardiovascular health. By lowering blood pressure, sunlight can reduce the risk of cardiovascular disease. 5. Skin conditions. A natural remedy. While excessive sun exposure can damage the skin, controlled exposure can be beneficial for certain skin conditions. Psoriasis. UVB therapy is a common treatment for psoriasis, a chronic skin condition characterized by red, scaly patches. Eczema. Sunlight can help reduce inflammation and itching associated with eczema. Jaundice. Sunlight is used to treat jaundice in newborns, a condition caused by high levels of bilirubin in the blood. Vitiligo. UVB therapy can stimulate melanocyte production in areas affected by vitiligo, a condition that causes depigmentation of the skin. 6. Improved sleep quality. Aligning with the circadian rhythm. Sunlight plays a crucial role in regulating the circadian rhythm, the body's internal clock that controls sleep-wake cycles. Melatonin regulation. Exposure to sunlight in the morning suppresses the production of melatonin, a hormone that promotes sleepiness. Improved sleep-wake cycle. Regular sun exposure helps synchronize the circadian rhythm, leading to better sleep quality and reduced insomnia. 7. Potential benefits for cancer prevention. A complex relationship. The relationship between sunlight and cancer is complex. While excessive sun exposure increases the risk of skin cancer, some studies suggest that adequate vitamin D levels, obtained through moderate sun exposure, may be associated with a reduced risk of certain cancers, including colon cancer. Some research indicates a link between vitamin D deficiency and increased risk of colon cancer. Prostate cancer. Studies suggest that adequate vitamin D levels may be associated with a lower risk of prostate cancer. Breast cancer. Some research has explored a link between vitamin D and breast cancer risk, but further research is needed. It's crucial to balance the risks of skin cancer with the potential benefits of vitamin D. 8. Enhanced cognitive function. Sharpening the mind. Some studies suggest that vitamin D, obtained through sun exposure, may play a role in cognitive function. Improved memory and attention. Adequate vitamin D levels may be associated with better cognitive performance, particularly in older adults. Reduced risk of cognitive decline. Some research suggests a link between vitamin D deficiency and increased risk of cognitive decline and dementia. 9. Increased energy levels. A natural boost. Sunlight can increase energy levels by boosting serotonin and nitric oxide production. Reduced fatigue. Regular sun exposure can help combat fatigue and improve overall energy levels. Improved physical performance. Some studies suggest that sunlight exposure may enhance physical performance. 10. Bone health and musculoskeletal benefits. Vitamin D from sunlight is essential for bone health and musculoskeletal function. Prevention of rickets and osteomalacia. Vitamin D deficiency can lead to rickets in children and osteomalacia in adults, conditions characterized by weak and brittle bones. Reduced risk of fractures. Adequate vitamin D levels can reduce the risk of fractures, especially in older adults. Improved muscle strength and function. Vitamin D contributes to muscle strength and function, reducing the risk of falls and injuries. Responsible sun exposure. Balancing risks and benefits. While sunlight offers numerous health benefits, it's essential to practice responsible sun exposure to minimize the risk of skin cancer and other harmful effects. Moderate exposure. Aim for 10 to 15 minutes of midday sun exposure on the face, arms, and legs, several times a week. Sunscreen. Use sunscreen with an SPF of 30 or higher when exposed to prolonged sunlight. Protective clothing. Wear protective clothing, such as hats and long sleeves, when exposed to intense sunlight. Avoid peak hours. Limit sun exposure during peak hours, typically between 10 a.m. and 4 p.m. Consult a doctor. If you have any concerns about sun exposure or vitamin D levels, consult a doctor. In conclusion, sunlight is a powerful natural resource that offers a wide range of health benefits. By practicing responsible sun exposure, we can harness these benefits and improve our overall well-being. However, it is vital to remember moderation and sun safety to prevent negative effects.